am living proof that the Walden data affiliation database thing does work, because I know there's like sites out. Hey guys, it's Noreen. Thank you for making it to my channel. And so today, as you can see, the title says approved and registered. So if you're new here, okay, I am a psychiatric nurse practitioner student at Walden University's program. I've been a nurse for 9 years. I do not have psych experience. I've been an ICU nurse and PACU nurse. So I started Walden's program in August of 2022. If I did everything correctly, this would have been my last semester, but unfortunately that's not how things happened, which is why I'm here sharing my experiences with you guys so that you guys don't go through the same thing. And so one semester I sat out because I kind of struggled that first semester trying to balance things and get a hang of things. So I was like, let me take some time off. And then the semester where I was supposed to do my first clinical for 6635, I had no idea that I was supposed to secure a preceptor in advance. So I took my 6635 course from February to May, and I did my clinical set for 6635 separately from May to August. And so now the following semester is 6645. And so last minute I had to find a preceptor by that deadline for 6635. So I did use NP Hub. I paid $3,000. I would not do that again because that's just way too much. There are other programs out there that are way cheaper, or at least like $2,000, or some may even be $1,000. So that's definitely something I want to share with you guys. And I think it's crazy because it's like, you know, we don't really want to pay for a preceptor, but it's like, well, at the end of the day, you'll be able to charge somebody someday. But anyways, so that's basically what happened there. So for my upcoming semester, the 6645, I did not want to pay for a preceptor because I just could not cough out the $3,000. So what I did was I went to Walden's data affiliation database thing, and basically it's like a database of places that previous students in your program went to and found a preceptor or did their clinical there. So that my recommendation is like some people are like finding their own preceptors and then trying to get it approved by Walden. Walden's denying it. Honestly, I feel like your best option is to just go with the preceptor that's already Walden affiliated, because you have a higher chance of not being denied, and you don't want to wait till last minute where you're scrambling around trying to find a preceptor, or you're falling behind because you don't have a preceptor. So my advice would be to either go through that database, try to find someone that's Walden affiliated, or word of mouth, if that works for you, just find someone that's already affiliated with Walden, because like it will just make your process way smoother, especially if you're pushing it towards the end of the line, like towards that date. I definitely recommend that. So for 6645, oh, this is the other thing too. So for 6635, you can use a psychiatric nurse practitioner or a psychiatrist. For 6645, no psychiatric practitioner, no psychiatrist. It has to be someone that does psychotherapy. So think psychologist, therapist, what's the other word? Therapist, a counselor. These are the people that do psychotherapy. And for 6645, your clinical has to be in person. There is no telehealth option. And for 6635, your first clinical, it has to be in person too. The curriculum says 75% in person, 25% telehealth. But in Meditrek, where you're logging your hours and doing your patient logs, it's not even an option for you to select telehealth. Like, it only lets you click direct patient care. And so it's going to be the same like that for 6645. But then for the last two clinicals, you can use a psychiatric nurse practitioner as well as a psychiatrist. I know they want you to use a psychiatric nurse practitioner for at least 2 semesters, and then you can repeat your clinical preceptor up to 2 times. So for 6645, I did go to the Walden data affiliation database thing. You put everything you want to put in, like you want to use a preceptor for the course, or like that a student in the past used for the same course that you're looking for one for. You put your zip code, all that stuff. So basically what I did was I put all that in, and then it gives you a list of places. So I emailed these people like, hey, I'm a Walden student. I'm looking to do my clinical rotation here. Are you available for these dates for this many hours? Yada, yada, yada. So not everybody got back to me. Some people didn't even respond to me. One person said they were full, like a psychologist said they were full, and that I could, like, if I wanted to use them for the following semester to schedule an interview. And then I did reach out to a doctor, which was like really annoying because let me tell y'all what she put me through. So I emailed her, then she emailed me back. She said to call her. So then I called her, but she was busy at a graduation, and it was like a Friday. So she was like, we'll reconvene the following week. So I'm like, okay. So then I followed up with the emailed her like, hey, you know, I'm the student trying to see if you can precept me for my clinical rotation. And so then she was like, okay, call me. So then I called her that evening, and then she's like, okay, email me. I kid you not, this sounds ridiculous, right? Then she was like, email me the details for your rotation, yada yada yada. So then I emailed her the details for my rotation. Then she tells me to send her $1,000 for placement and all this stuff. I don't even know if I had to pay beyond the $1,000. I didn't even entertain it after that. I was like, you know, why you just could have told me this from the beginning when I emailed you in the first place saying that I was looking for a preceptor. You could have told me about your little $1,000 cost from then. And then I had to do this whole run around just for this. No. So I just didn't even bother back with her. So then I went back to data affiliation base, continued to reach out to people. And then finally I got this one location that I found on there and previous students used. And so, I submitted my application in time, but one piece was missing, the preceptor commitment form, but it was my fault. Like, I don't know if I didn't send it to her or something like this. And so my application, they like closed it because it wasn't complete after the deadline. So then I had to do the wait list thing, which you get approved to be on the wait list, but like they tell you, like, you know, big red flags, red signs that it's not a guarantee that you'll get placements, yada yada yada. So I did the wait list thing, and I even tried to ask them, you know, I'm just missing one thing. I have the whole application here. Let me just add this one thing. They're like, no, you have to do it over. So I did the whole application over, and I was on a wait list, and they basically took forever to look at it. I emailed them saying, hey, what's going on? Maybe like a month before the semester started, like saying, hey, what's going on? Can you guys check my stuff so I know if I have a reasonable amount of time if it's gonna be approved or not? And they told me that, oh, well, we don't start checking until 2 weeks up until the semester start. So I'm like, okay. So then, like in the beginning of August, they like emailed me saying that we needed to get like two things, like one thing needed to be fixed, like an email didn't up top didn't match the email at the bottom. So make sure you guys' emails matches on there. And then so I sent to my preceptor, she fixed it, sent it back, boom. So I resubmitted it. Then like a couple days later, or maybe a week later, they sent me an email saying, oh, like the name was spelled wrong or something wasn't checked, something very minimum, like minute, okay? And so then I had my preceptor fixed it, and boom. Like a week or two go by, still didn't hear nothing. Then finally, August 15th or 16th, like this, it was a Wednesday, I finally got the email saying that my clinical has been approved, my practicum has been approved, and that, you know, I've been accepted and registered. So thank God, I was happy. And the semester starts August 26th. So I just can't even imagine if it didn't even get approved by the 15th or the 16th. Like if they told me that day that it was not gonna get approved, you know? Like my heart would have just dropped. Like that is so short notice, like that's crazy. So a week and a half before the semester starts is when they told me it was approved and registered. And so that's just so you guys know, if you're on that wait list, you'll probably find out 2 weeks up until the semester starts whether you're accepted or not. And so the thing for me is that I'm going to say I am living proof that the Walden data affiliation database thing does work, because I know there's like sites out there that say don't even waste your time with the Walden affiliation thing. My thing is, if you have time and you have time to do this in advance and be proactive, even if it's a couple semesters in advance, I would recommend you to take this course, take this option, because even if you're saving $1,000 or $2,000, if you have to pay, that's way better than coughing up to $3,000. And then going through the data affiliation base, you kind of already know that more than likely they're going to be approved because they've been used by Walden already. And so, yeah, I would definitely recommend it. There's a high chance that you can find someone for free. I know a lot of people who've done all their preceptors, found all their preceptors on there, all their clinicals on there, and they didn't have to pay anything out of pocket. So I definitely recommend it if you have the time. So for me, going forward, I'm not gonna lie, I'm probably going to pay for a preceptor, because going forward, we can do mostly telehealth, and I want to be mostly telehealth. I don't really want to be commuting nowhere. So like going forward, I probably will pay, but I'm not paying no more than $2,000. That's where I'm gonna draw the line. And then the other thing too is that, so I found this out August 15th. The semester starts August 26th. So the winter semester, the next semester, your clinical deadline thing, your application, your practicum application is due September 1st. Guess who doesn't have a preceptor? So we about to be going through this all over again. Well, hopefully not, because I mean, I have some potential preceptors. I think the other thing I will say is that definitely word of mouth makes a difference. So if you have some friends that have a preceptor that takes Walden students or preceptors for your program, I will definitely recommend going that route, especially if it's a Walden, if they take Walden students. Just go that route and secure the bag, because it's just easier that way. So I'm excited. So yeah, the semester starts August 26th. So one thing I will say is, per the syllabus, is that you can't even do your clinical on the first day of your class. So if you start August 26th, you can't take clinical, you can't start your clinical August 26th. If you log in any clinical hours that day, it says that it won't count. And then for the semesters, you have to do 160 hours. And see a minimum of 80 patients. And then, so for this one, it has to be 5 children, that's 12 and under, 5 teenagers, that's 12 to 17, 5 adults, 18 to 64, and then 5 geriatrics, so that's 65 and up. Those are the minimum. I know for the 6645 and the one after that, it's like 40 and 40 combined, like 40 kids, 40 adults, and geriatrics. So that's that. And then, so that's a minimum of 80 patients, and then 160 hours. And then I already told you guys about the direct care, like it has to be in person. And so with your Meditrek, you'll be able to log your patients, and it's going to ask you about the location. Like, are you at a private practice? Are you at a psychiatric center? You're going to put female, male. You're going to put the age range you're seeing. You're going to put what type, is this an assessment? Is it intake? Are you doing psychotropic therapy? Like, what are you doing psychotherapy? You're going to log all that in there. And then the other thing is, so like I told you, it'll ask you direct patient care or telehealth. Telehealth is like grayed out. You can't even click it, so you don't even have to worry about that. And then it lists the disorders, and so those disorders are so old school. It's so ancient. Like everything is not even on there. Like depression is not even on there. And that's like one of the things you mostly see. Like they have anxiety disorder, adjustment disorder, mood disorder. So sometimes when I would need to do depression, I would just log it under mood disorder, and you can't click more than one. So you have like anxiety, adjustment, mood disorder, whatever. For ADHD, it has like the impulse control, trauma, stress related, things like that. So you'll basically click that, and then there's going to be a box where you basically put your synopsis on there, like the initials, the age, female, scene 4, medications, treatment plan, diagnosis, things like that, and your whole synopsis note. You're going to put that in there. So that's just an idea of how the Meditrek works. And then you make sure you're numbering. So like I said, I would put my notes in a Word document, and I would number my patients so that I know what number they're going to be logged in, because that's also important when you do your comprehensive psych evaluations, because sometimes your professor might be like, what number patient are you referring to? And they're going to go there to make sure you're actually using a patient that you saw in clinical. So that's important to know. And then the other thing I wanted to talk about is that I saw some people asking, oh, when it comes to logging hours, like, do you have to get approval for more than 8 hours or whatever? I never had no issues with that. I used to log 9 hours, 10 hours, and I never had any issues. And it's like, I don't really think they can tell you what you can and can't do for X how many hours, because especially if you're going to a hospital, you're probably going to be there for 12 hours. So they can't really tell you you can't do 12 hours. And this is clinical. Like, what are you saying? And then I also saw someone saying, like, how do you log in your lunch hours? Like, do I do 8 to 12:30, then 1 to 6 p.m.? I didn't do any of that. I kept it simple, okay? I did 9 to 5, 9 to 6, whatever I needed to do. Like, I'm not breaking up nothing like that. And then, you know, the first few assignments, you have to make a calendar, like what's your schedule, what days you're gonna go to clinical, and you have to list the hours, like 9 to 6, 9 to 10, whatever, 9 to 8, whatever you're gonna do. And so I also saw, what I did was I went into Canva and I got the calendar in Canva and just kind of inserted like you do the template on Canva and you insert your dates for your clinical, you submit that. And then I've also seen someone asking like, oh, how do we get approval, or do we have to get approval if our dates change? I honestly don't think our professors are looking at this like, oh, this person logged that they're going to be here on this day and that day, because these professors have other jobs. This is just one of their jobs, but I don't know, don't quote me. But I know I had to change some dates after my clinical preceptor told me she wouldn't be available on XYZ dates, and it is what it is. I didn't have to go get no approval from nobody or anything like that. So those are just a few tips that I definitely want to put in there regarding clinical. And if you guys have any questions, just let me know. Oh, the other thing I want to talk about was that somebody asked me, how do I balance work, school, and the clinicals? And the answer to that question is I don't. I be struggling, okay? When I tell you I be struggling, I be struggling. And then I'm a gym rat, and so I'm not giving up the gym for nobody. I'm not giving up for no program, because that's how I take care of me. That helps with my mental health. So, and that's my priority, is my workout, okay? So basically what I would do is I typically go to workout in the morning. I'll work out before clinical or before work. So I'm waking up 5, 6 in the morning to work out. I try to do my homework throughout the week. Definitely turn my discussions on time or something like that. And I'm not even gonna lie to y'all, I do my assignments on Sundays. Like, I'm usually off on Sundays, so I do all my assignments on Sundays. And so that's basically what I do. I try to, like, you know, do it more in advance, but it just doesn't work for me. I work better under pressure, so I just wait till the last minute to do my stuff. But don't be like me, be better than me, okay? And then the other thing I wanna talk about is, I'm gonna be honest with y'all, right? So I told you guys that like, I struggle with turning things in on time, and this was where I really struggled in the first semester. So basically what I learned in this program was I had to decide, do I turn this assignment in on time, half-assing it, or do I turn it in late, like actually giving my all, doing all the parts or whatever? And it turns out for me that I got a better grade when I would turn it in late, doing everything I needed to do. And it proved this point twice. I did it a few semesters where like I would like half-ass my paper, and then like I would get like a B or something like that, right? And then, but when I turned it in on time and I actually answered all the questions and put all the details and all my resources, I would get like an A. And so the same thing happened the last semester with 6-3-5 in that clinical with those comprehensive psych evals. So the first one, I turned it in late, but I did everything right, like did everything I needed to do, and I got an A, but it was like a lower A, right? Because I did lose some points for turning it in late. Then the second time around, I was like, okay, well, I'm gonna do this early. So I just kind of half-assed it, because I was like, I got an A turning it in late, so I should get an A turning it in on time, right? I don't know, for some reason I ended up getting a high B. So I was like, okay, well, this is like the second time in a semester, the second semester that this has happened. And so the third time I turned it late, and then I don't know, I got an A. So, but I turned it late and I just made sure I did everything I needed to, and I ended up getting an A. So if you're in this situation like me, do what you have to do. I would say just make sure you do everything that's in the rubric, in the requirements. Make sure you do everything right, but don't turn it in late. Try to be better than me. Okay, so I hope you guys enjoyed this video. If you found it helpful, please subscribe and share this with someone who can use this information. Thank you guys for watching.